One of the things that I see a lot in some of the book groups that I belong to is that there's a certain kinds of facelifts that are better, and it's a huge debate. The difference between a deep plane and a SMAS. And
Sure.
can you touch on that? Do you
Absolutely.
think that one's better than the other, or why would you choose one over the other?
Gotcha. Well, it's patient dependent. One's not better than the other. It depends on what the patient presents with and what you're trying to do, and also what's available once you get into the SMAS layer. That's the layer of fascia, and it has some muscle in it. That's the layer that you will pull back to give that foundation to redrape the skin with. And if you don't do that, it will not last a year. So some patients, if they do not have let's start at the end of the spectrum. Patient comes in, has a big neck, terrible jowling. On that patient, I'm going to try to do a deep plane facelift on them. But the determining factor is once you make the skin incision and you go deeper and you're looking at the SMAS, how thick is their SMAS? Because if it's super, super thin, all the muscles that work, all the nerves that work the muscles in the face are right underneath that. And so if it's super thin, you're putting the patient at greater risk of nerve injury. Typically, though, a patient that has big neck, bad jowling will usually have a nice thick SMAS. And I can give you, if you want to include a video of what the SMAS looks like, I've got some footage, I can show you that. So on those people, we like to do a deep plane where we can get the maximum pull of all this tissue upward. Now, short of that, you have a couple things. One is you can do a SMASectomy. And with that would be a patient that, has significant jowling, but the neck is not as bad. And you want a good pull, but you don't need a deep plane type pull. You go in front of the area of the parotid gland and you take out a wedge of the SMAS. And then you take that edge that's more, we call distal, and you bring it back and you suture that. That's a SMASectomy. Then from there, you go into plication procedure. And if you have someone that's real thin, they've got jowling, but nothing is overwhelming, you can take the SMAS layer and you can just take suture and then fold it over and bring it back and suture it and then make it smooth with liposuction. And you don't, that would be the indicator would be a patient that doesn't need the other. So you want to give the patient what they need. If a doctor shouldn't ever say, what kind of facelift do you do? I do deep plane on everybody. Well, no, that's not right. You're taking extra risk and just doing more surgery than it's needed because you can get the same results with less risk to your patient. And sometimes you get in and the SMAS, especially on a repeat facelift, the SMAS is so thin, you really don't have much you can pull back. So that's when you would use like a plication procedure. So, a surgeon that's got a lot of experience will pretty much tell you just what I told you. They do all of those things, and whichever fits that patient and whatever amount of SMAS thickness you have to work with.
So what I hear you saying is that you don't know until you get in there, oftentimes, what you're going to do.
Right.
So all these people that are like, well, I'm getting a deep plane facelift, and all they've had is a consultation.
Right.
Is it?
You can tell pretty well by looking at the patient, but you can surely be fooled by how thick the SMAS layer is. It's just not consistent. So, surgeon should be prepared to know how to do all the different ones. And to do a deep plane on everybody is uncalled for. You just don't need to be putting your patient at additional risk.